Hello, everyone. I'm Dr. Luana Marques. I'm Associate Professor at Harvard Medical School and Director of Community Psychiatry Pride at Mass General Hospital. In this webinar series, we're talking about regulating emotions and building resilience in the face of a pandemic. Today, we're going to be talking about active techniques to slow down the brain. Those techniques are grounded on something called cognitive behavioral therapy, or CBT. CBT is an evidence-based type of psychotherapy that has many types of randomized controlled trials and a lot of studies showing that's effective. In our research lab at Mass General, we created a simpler version of CBT, which we call TAB, Thoughts, Emotions, and Behaviors. And we share those skills with our community today to help you slow down your brain. Before we go any further, I want to take a moment to really thank the Harvard Medical School leadership, specifically the Dean's Office and Administrative Leadership, the Program in Graduate Education, the Office for External Education, the Office for Postgraduate Medical Education and Human Resources. I want to thank the Harvard community for coming together in a very short notice and producing this webinar series, and for caring about our community's mental health in the midst of a pandemic. In the first webinar that we created, we talked about the role of anxiety and how anxiety affects us in the midst of a pandemic. And I'll actually review a little bit about that before we move on to today's topic, which is slowing down our brain. Subsequent webinars will talk about staying connected and charging up and techniques to help you explore your thoughts. Some of those thoughts that can be really catastrophic in moments like now, thinking about what if I catch this and what happens, and helping you to bring your brain back to the zone. So before we talk about cooling off our brain, it's really important for us to anchor back on anxiety and what is the role of anxiety and what we are all experiencing right now. In the first webinar, we talked about the fact that anxiety is expected and adaptive, but only up to a point. We talked a bit about the fight or flight response and how we're all wired to respond to real threats with anxiety. But when it becomes too much, it paralyzes us and hinders our ability to move on. We talked about a specific tipping point that gets us past that zone where anxiety becomes too much and interferes with our ability to function. Many of us may have moments in the past week or so where we found ourselves there, when we get news like our school's closing, and for a moment, our brain just going blank and not knowing what to do. We also talked about taking the anxiety temperature, and we encourage our viewers to do a measure called the GAD-7, which we made available in our resource page. The idea here is to have a baseline for yourself or where your anxiety temperature is. But also remind our viewers that all of us might be a little elevated right now, and that's okay. Anxiety is expected in the midst of a real threat like the COVID-19. And finally, we talked a little bit in the end of our first webinar about labeling our thoughts, emotions, and behaviors as a way to stay in the zone. The anxiety continues to rise related to this virus. If you just take the last week, the news has changed very similarly. Most of us are working from home. In our own state, the governor closed lots of our schools, most of our schools. Life has halted as we know it. The anxiety is posted vividly when we looked at a Google trend that looks at coronavirus and anxiety. If you quickly look at this graph, what you see is an increase in Google searches on those two terms together. What's really interesting from this graph for me is that in the past 7 days, that search really peaks between 11 p.m. and 4 a.m. It means a lot of us are awake in the middle of the night worrying about what's to come. And it is a real threat, so it makes a lot of sense for us to be in a state of alert. But the question really is that really good for us? And is there a way to cool off our brain? And that's really what we're going to be talking about today. Before we go any further, I want to welcome my colleague Anna, who works very closely with me and who is going to be sharing some of her experiences about anxiety after this virus. Anna, how are you doing?
Hi, Luana. It's great to be with you today. I'm okay, I think. I've been reading a lot of the news in the past week and even before that to really try to stay ahead of all of the information. I have family that lives all across the country in Florida and California and Michigan. And so I've been going back and forth between local news sources as well as national news sources as well as global news sources. And I think that I really hit a point where, you know, I'm trying to be as prepared as possible. Even within the last week, our team shifted more to remote work. And so I had planned for that and gone grocery shopping to get extra food for that. And then I was notified that my husband, who's actually a medical student at Harvard, now, will be on pause for his clinical clerkships for the beginning of this week. And so then we had to go back out and go grocery shopping because our food schedule changed a bit. And so I think I've just been consuming as much as possible to ensure that I'm really up to date. But I think it's been a lot, but it's okay.
Well, let me slow you down a little bit. So, well, first, thank you for sharing all of this with us. I think many of us have seen life as we know really halt, right? And as we saw on that Google trend, that's creating this general sense of anxiety for our community. And it sounds like for your family, it's hitting really close to home. I want to hone in on something that you just said a little bit, Anna. As you were talking about it, I have to confess, I had a little like heart pounding as you talked about it. And so I want to hone in. You said you're following a couple of different news sources. Can you tell me a little bit about that?
Yeah, well, I like to check. Usually in the morning, I used to listen to The Daily, which is a New York Times podcast. But since this has been happening, it really doesn't cover as much topics as quickly. So I've also been looking at BBC as well as CNN, and then also some local news sources, including the Boston Globe, and sometimes looking more to some of the sources in Michigan as well. And then, of course, following the CDC and the World Health Organization, too.
So you're watching a lot of news, I was wondering, as I mentioned to you, it got me a little sort of overwhelmed just thinking about all the news that you're doing. I was wondering if you, with your permission, if we could pause here for a second and for our viewers, really talk a little bit about flipping through the news. From what you just said, you're spending a lot of time going from one news source to the other, and I imagine many of us are stuck at home and our news consumption is going up. A lot of us are now commuting. So I imagine that your experience is very similar to our listeners right now. So would it be okay for us to talk a little bit about what you experience as you're flipping through the news?
Yes, of course.
So let's think on this idea of like all the news sources that you're flipping through. The first thing that I'm really interested in is what is that doing to your emotions? Like how is it affecting your body? And by the end of the day, what does it feel like?
Yeah, it's interesting. You mentioned that your heart was getting racing a little bit. I noticed my hands are actually a little sweaty right now recalling all this. And so, I definitely feel more tense, especially as I keep going through more headlines and it seems like there's larger numbers and more happening. So I feel tense, my palms are sweaty, worried too.
Mm-hmm. So it sounds like I'm going to slow you down for a little bit because you're really giving me a bunch of chunks of things. Yeah. You started with like the emotions here on the tab cycle. We talk about emotions and physiology. So you anchored there first, right? You led with my heart responded a little bit, but your hands were sweating a little bit. And then you said, well, I flip and there was those headlines and I could see the behavior. You're actually flipping through it. Mm-hmm. And then you said, wow, but that's getting me really worried, right? I thought like, wow, the numbers are going up. And it sounds like the more this happened, the more you're spinning. Am I right, Anna?
Yeah, I think so.
So it sounds like flipping through the news may feel good for you momentarily because you feel like, okay, your family's everywhere. You want to get ahead of this. You want to really control this a little bit. But then it sounds like by the end of the day, it's really causing some physiology for you.
Yeah, it's tiring. I think I feel tired too.
Absolutely. And Sienna, what's happening is by looking at the news all the time, what you just described is an activation of your limbic system. The limbic system is our fight and flight part of our brain, is the part that gets us prepared to run from danger. Now, there is a real threat here. So some limbic system activation makes a lot of sense. But the problem that we have right now is many of us have a hyperactivity on our amygdala, and we're really getting to this place where it's hard to shut off our brains. And what we want to be doing is actually the opposite, right? We want our community to be able to slow down their brain a little bit. And so, what we want to talk today is how do we do that? Many of us are hearing about limiting our media consumption, but how do we actually do this and why do we do this? In our lab, we really came up with 4 tips to help all of you slow down your brain and get your brain back to the zone. First thing we want to talk about is practicing the tab cycle, exactly how I just did with Anna. We then will talk a little bit about viewing reliable sources of information. What does that mean, and what should we consider to be reliable sources of information? We want to also teach you a little bit about how to anchor on your prior news consumption. And finally, we'll talk about engaging in healthy habits. So let's dive in and talk a little bit about those 4 tips to slow down your brain. The first one is using the tab cycle and slowing down this idea of flipping through the news. And I just went through that with Anna. I slowed her down. You saw that she said her problems was sweating, and then she looked at the news more, and then she get anxious thoughts. And then I slowed her down and really helped her think through this slowly. And that's what we call practicing the tab cycle. So really, the skill here is for you when you're watching the news and your heart's pounding, slow down, take a piece of paper, and really go and write down what you're saying to yourself. How does that make you feel? Walk away from the TV a little bit. Practicing the tab cycle is one way to get our brain to slow down. Another variable that really helps us to cool off our brain is to view reliable sources of information. Why do we want to do this? Because we're all getting inundated. It's hard to figure out which news we want to follow. I think Anna did a beautiful job to talk about, well, I'm watching local news, global news, Florida news, California news, and our brain gets more and more activated. So we really recommend that you anchor on 2 reliable sources of information for all of us globally: the World Health Organization and the Center for Disease Control and Prevention, the CDC. Now, one of those sources of information, the WHO, has suggested that we seek information updates at specific times of the day and once or twice only. And you might have heard this guideline on the news again and again, that we should limit the source of information. And the WHO has been very specific here. I think one way that we can do this is sort of like, okay, we want to limit this consumption, but how do I do this? Is to anchor on prior news consumption. So what did you do before this all started? Before you had 2 hours of your life back because you're no longer commuting to work. So I get very concrete here. I think about, okay, before this pandemic started, on Monday, as Anna illustrated, she watched a little bit of a newscast in the morning and a little bit in the end of the day. We want to go back to that same pattern before. And we want to figure out how to get enough information that we stay informed, but not too much information that we are constant on fight or flight. And the reason we want to do that is because we want to bring our thinking brain back on. Our prefrontal cortex is the part of our brain that actually helps us plan. That's the part of our brain that helps us do things like get a new schedule in order when now I'm working from home and my kids have to be homeschooled. So we really need to have our prefrontal cortex on for us to be able to engage and plan and really be effective. The problem is when we have that limbic system activation, when we're watching all that news, we're actually robbing our prefrontal cortex from being on. So the tips that we shared so far, the ability to sort of really anchor using the tab cycle, anchoring good news, being able to limit your news to what it was your pattern before, walking away from it is one guaranteed way to cool off your limbic system and bring back your prefrontal cortex. And how does that sound to you now that, you know, how does those techniques sound as a way to cool off your brain?
Yeah, thank you, Luana. I think that those are really helpful and they sound doable. You know, I had a schedule before of habits of when I would check the news, just like you said, and I think I can. And I actually didn't even realize that I wasn't engaging my thinking brain. I thought when I was checking the news that I was able to plan more, but it sounds like what you're saying is that actually that's more of my like limbic brain that's working and not my thinking brain when I'm doing that. Is that right?
That's exactly right, Anna. What's happening is that, by looking at that news, we have this perception that we're getting more information, but there's a saturation point that all of us reach. And because the news are actually associated with a real threat, it's sort of impossible not to activate our fight or flight. And so the more we stay there, the more we actually end up on this sort of limbic system response. And we might imagine that we're actually helping ourselves, but we actually hindering ourselves. And I also want to point to us that the more we are activated, right, the more anxiety we have, the less we're helping our immune system. And all of us have heard about really make sure our immune system is the best it can be right now. And so I really would encourage all of us to practice those steps so that we can not only cool off our brain, but also help our limbic system.
That's so helpful. And I really think that I can do these tips to slow down the brain. Is there anything else that I could do?
Yes, there's one more tip that we added here on cooling off our brain was really to engage in have healthy habits. So, and this can be challenging right now because we all cook up at home. But I think this is where, the virtual world can be really helpful. So not only doing things like watching a webinar like this and learning more about how your brain functions and how to cool it off, but making sure that you're going for a walk or you're reading a good book or you're connecting with your loved ones. Social support is crucial in a time of elevated stress. And right now we might be cut off from those people that are our network. So as simple as, having lunch with your coworkers through Zoom or Skype or FaceTime in a way that you can connect again. And I think practicing those habits, again, not only will help our anxiety to come down, cool off our limbic system, bring our thinking brain back on, but also help your immune system. And I think that's really important. So I wanna before we end, talk a little bit about some take-home message today. What do we hope that you get from today? First thing I think Anna and I really talked about is the excessive amounts of news consumption activates our fight or flight, our limbic system. This may be counterintuitive to what you thought about before, but as we experienced in our conversation with Anna in this webinar, just recounting what was happening was getting her palms to sweat. And I had some heart pounding just thinking about her flipping through those news. So we want to really think about how much we're watching. Then we shared with you 4 tips to cool off our brain. And we want to encourage you to start practicing those steps. The first one was to limit news consumption by using the tab cycle. We talked about viewing reliable sources of information like the WHO and the CDC. Going back to our pattern before this pandemic started and anchor the amount of news consumption to what we did before. And here it's really important to think about the WHO recommendation that we do this once or twice a day and that we really fight this urge of doing this again and again. And we also recommended engaging in healthy habits. Our tips are really designed to help your brain get back to the zone, to get you to be able to weather this storm that is really difficult and clouded with a lot of uncertainty in a way that you can get yourself to be in a place that you can actually engage your thinking brain, get ready to plan, and control the things that we have control now, like creating a schedule for your kids. And I want to bring you back in. How does those tips sound like? And did this help you with your consumption of news that you shared with us?
Yeah, that's really helpful. I think one of the things that also stood out this time is that by limiting my news consumption, I'll also have more time to do those healthy habits and behaviors that you were talking about. One last point that I did have though, in thinking about that is, I've switched to remote life and having most of my work and things happening now at my house. And even within 5 days, I really find that I'm struggling to come up with things to do sometimes. Most of the time to gain energy, I would go out for a run or a walk or the gym or hang out with friends. And it just seems like right now with all the guidelines that I'm really confined. Do you have any suggestions for how to think of these activities that we can be doing?
Thanks, Anna. So I definitely do. But, the first thing is I really loved, before I even go to suggestions, I want to go back to what you just said, which I think for our listeners is so important. This idea that by taking away the time where you might have been watching the news, you can actually engage in healthy habits. I love that idea. And I'd encourage everybody to maybe think about scheduling those things. When we're at heightened stress, sometimes we just don't get to things that are good for us. So I love Anna's spin here of like really robbing from that time and cooling off her brain, but engaging in something good. Your second point, Anna, was this idea of what else can I do to manage the fact that my life is now remote and I'm feeling cooped up? And there are a lot of things that we recommend. In our lab, we call those skills charge up. It's the idea of behavior activation to keep your body moving. And I think in this case, sometimes we're experiencing such social distancing, and that sometimes we're thinking about that as social isolation. And we're also thinking about like, what can I do? I can't really do much. So what we're going to do for you and our viewers is actually create a new webinar where we really talk about what are the skills that you can use to charge up? What are the hints that we have that can allow you to stay engaged and keep your body active? And so we'll not share those today, but we'll be sharing those in the next webinar. I want to finish by once again reminding our viewers that we're going to have a resource page for this webinar and our webinar series. We'll not only have resources from Harvard Medical School, but also have resources for national organizations such as the Anxiety and Depression Association, so that wherever you are, you can able to connect with us. One other point before we end, I really wanted to make sure that we hear from you. To do that, our team has created a survey that will be in our resource page, and that's really designed for you to give us feedback on these webinars, but also ask your questions. We really wanted to be able to use the next scheduled webinars to apply skills to your own concerns. So much like Anna is looking for tips to charge up, to figure out how to deal with staying connected while she's at home, we want to hear from you so that we can actually address your needs. I want to finish by really thanking HMS and the leadership for putting this webinars together, and thanking you for listening to us. I hope you all practice these skills to cool off our brain, and we'll see you in the next one.